Hi. When we're talking about eyelid surgery, you can be talking about the upper eyelid or the lower eyelid. Frequently, when we're talking about the upper eyelid, patients, often around the age of 40, begin to notice an excess of upper eyelid skin and perhaps a little bit of fullness over here in the corner as well. This full, extra tired look can really make us feel tired and seem angry and really ages us. So upper blepharoplasty, and that's just another word for eyelid surgery. So upper eyelid surgery is a great minimally invasive way with very little downtime to actually achieve a much more rejuvenated look. Through a small incision that's made right here in the crease and actually is really not very noticeable, once it heals, you can really achieve a very relaxed and very natural look. I spend actually a lot of time designing what the incision is going to be and what the outcome is going to be with the patient. And sometimes I actually make the comment that the time spent doing that design with the patient is actually more than the time that's spent in surgery, because those surgical markings have to be so precise, and we really want that look to be achieving exactly what the patient wants. And of course, every patient wants the most natural and most rested look, because the goal is for you to look like you, just to look like a great version of you, without looking like an operated version of you. Lower eyelid surgery most frequently is reflective of a tired look because of tired, baggy, saggy, puffy look underneath the eyes. And generally that's because of what we call a pseudo herniation, which just means a puffiness or pouching out of fat pads. And people can get that really at any age. There are some patients who have them even at age 21, and they'll notice that they'll always have kind of like a little bit of puffy fat right around here. But there are really 3 pockets of fat where you can see that. And they can really come out at any age, but again, it tends to really be an issue as we near 40. So this also can be a great, again, minimally invasive way that you can have a quick recovery, non-painful, smaller surgical procedure that can also be done under local anesthesia, and that you can recover and get a really refreshed, natural look without changing your appearance. Sometimes patients are also complaining that they're having hollowing as well. Occasionally, then, we will couple this procedure with adding some fillers, which can be any of natural fillers that we use here in the office, or even your own fat. Overall, whenever you're considering a procedure to refresh the eyes, always look for the upper and lower eyelid. Also consider the appearance of the skin itself, because sometimes just a laser procedure can just refresh and diminish the appearance of the fine, creepy lines around the eyes. In addition, also consider the brow. Don't forget that our eyebrow is also part of our eye unit. And sometimes it's really not an issue of the upper or the lower eyelid, but it really is an issue that our brows are, sorry, I hate to say it, starting to fall down. Gravity wins. And there are several procedures that we can do to help elevate the brow. They can be as minimally invasive as Botox, sometimes some of our laser procedures. In certain cases, L-therapy can be helpful. We also use profound radiofrequency. And of course, a surgical brow lift is also a great procedure with really hidden incision lines to really rejuvenate the brow and, again, restore you to you and have everyone think that you just went on a great yoga retreat instead of thinking that you just had surgery.
Perfect. Okay.